Hi, my name is Anne Russell. I'm currently reading through my book Alcohol and Pregnancy, My Responsible Disturbance. This one here. It's available on Amazon if anybody wants to buy it. But I'm reading it for free because not everybody has the money to buy books these days. And there may be people who prefer to hear it. So, and I want to make sure that, I guess, the main reason is I just want to make sure it's available to anybody who wants it or needs to hear how other people managed after finding out that FASD exists and that their child might have it. And I just see here that I have not got my collar done properly. Typical. Alright, this chapter is called Mick's Zombie Mother. So 3 hours of sleep each day was not sufficient for either of us, and it affected every aspect of my life, obviously. I didn't have patience for Don, I didn't have energy for housework. It was all I could do was to look after Mick and do the washing before flopping onto a lounge chair to try and sleep. The first few months felt like torture, and clearly it was not a happy experience for Mick. I knew there was something wrong with him, even if the doctors said there wasn't. No one seemed to know what to do. Not the nurses at the clinic or the doctor who came into town once a week. I refused to ask my mother, and Don's mother was looking after Don's father, who had a chronic illness, so I didn't want to place any additional stress on her. Mick could sleep for 30 minutes, but would then wake up screaming. I remember lying on the bed trying to sleep in fits and starts. I had my foot on his pram, and when he cried, I jiggled the pram, while hoping I could have an additional 1 or 2 minutes sleep. Eventually, I learned to do it while I was still asleep. Probably only gave me an additional 5 minutes, but they were precious. And this is just a little aside in a text box. Infants prenatally affected by alcohol may have problems with state regulation. This means they have delays in developing normal sleep patterns, trouble managing normal levels of stimulation when feeding, or increased irritability from touch, bright lights or sounds. And obviously I didn't know any of this when Mick was little, and I muddled through. I don't know how he's still alive, to be honest. I mean, how he got through those years. I mean, I don't know what was wrong with him. Obviously he doesn't remember now at 38, but oh my God, he was a tough little fella. I was turning into an automaton, but was powerless to do anything different. It seemed that every minute of every day was dedicated to holding him, feeding him, trying to soothe him, or changing him. My days were a blur. I wasn't functioning on any but the most basic of levels. And I remember one day grasping that it was in my power to do something to quieten him. My thoughts coalesced as I looked at the wall opposite his cot. It was like the metaphorical life bulb flashing above my head. I could stop him crying. I could liberate us both from this endless suffering. If I picked him up out of his cot and threw him at the wall, he would stop crying. I recall wondering why I hadn't thought of this before. I was relieved there was a way to get some sleep. So what completely shocks me now is that this idea at the time felt like a logical, rational thought. I truly believed that I had thought it out and it was a reasonable solution to our predicament. If anyone had come into the room at that time, I would have turned to them and told them about my idea. It would have shown how truly out of my mind I was. So for many minutes I held him and looked at the wall opposite. I didn't shake him or yell at him. I just held him, not even conflicted about my decision to throw him at the wall, just reluctant to change position so I could use my arms to throw rather than hug my beautiful son. Something changed in me, thank God. Perhaps it was my higher power. A higher power I didn't know I had at the time. I placed him gently back into his cot and walked out of the room. I rang my friend Cable and asked her to look after him while I slept. What a relief it is to me now that I didn't hurt my baby. Nevertheless, I have total compassion for those mothers who change their lives and those of their baby forever in a moment where lack of sleep makes unreasonable thoughts seem quite reasonable. As Mick grew, he started sleeping longer, and eventually I could go to bed. And even though I went into him a dozen times a night because he was unsettled or crying, I was able to sleep well enough to function. Because he'd been was such a difficult baby, I seemed to be always attuned to his needs. One evening I woke up and quickly I knew something was wrong with him. No sound had alerted me, but I knew that Mick was in trouble. I ran into his room and touched him. He was burning up. His temperature was 104 and he was making strange, jerky movements. Now I think this episode was probably related to a seizure disorder, which later manifested in a different way. I ran a cool bath and gave him some baby Panadol. In a few hours, his temperature was back to normal. At that time, there seemed to be no reason for this high temperature. Now, as an aside, in this text box it says, high temperatures with no apparent reason seem to be common in babies prenatally exposed to alcohol. So there you go. As a result of this incident and its unknown cause, we travelled to the coast to a paediatrician. I explained that Mick had not been feeding and sleeping as well as he should. The doctor suggested I try soy milk because he thought that Mick might be lactose intolerant. I was immensely relieved when he responded well. He'd not been thriving, and the nurse at the medical centre in Greenvale was concerned until he had been on soy milk for a few weeks. It wasn't easy to get in Greenvale, but until the pharmacy could source the milk, I drove 300 k's into Townsville and bought it in bulk. To complicate matters, I am anaphylactic to peanuts and soy products, so it seemed strange that my son was not allergic to peanuts and needed soy milk to thrive. It was an inauspicious start for a man who was to overcome so many difficulties to be one of the finest people I have ever met. Over the next few months, Mick was in and out of the medical centre with colds, flus, fevers and ear infections. He picked up every bug that was going around. His immune system was not functioning adequately, and he was a weak, sickly child. I often had waking nightmares that he would not live through this stage of his life. That's the end of the chapter, but I have to say that the number of times that I was in the clinic, while I was still fairly naive, I could see that every time I came into the clinic, the nurses there would roll their eyes. There was always something wrong with Mick. It wasn't though I was just being a hypochondriac on his behalf. It just added an extra dimension to my anxiety and it just made my life that much more difficult at the time, because I could see them looking at each other and thinking, here she is again with this poor child. And I felt like an absolute failure of a mother. Man, I can still feel that feeling, and it's not a nice feeling. So if any of you who are watching just happen to be the nurses or people who experience these women coming into clinics or always having these children who are always ill, please don't roll your eyes. Please treat them like the normal human beings and normal mothers that they want to be treated as. Well, that was a short chapter. I will see you next week with chapter 10, which is the hearing test. All right, thank you very much.